Welcome to the last breakfast. Please enjoy the video.
You start by confirming the kit contents and preparing the saline so the rinse works effectively. Mix the 0.9% saline sachet into 250 ml lukewarm water, stirring until dissolved. This keeps concentration accurate for comfort. Once mixed, wash your hands thoroughly for at least 20 seconds and attach the nozzle firmly to prevent leaks. Do this now to avoid interruptions. The correct solution and a secure nozzle are why the rinse reaches sinuses evenly. You lean over the sink at about a 45 degrees angle and tilt your head to one side so gravity guides flow through the sinus passages. Insert the nozzle gently into the upper nostril and keep breathing through your mouth to avoid swallowing fluid. Squeeze the bottle in a controlled, steady motion so the solution flows through and exits the lower nostril. This clears mucus and allergens. Once done on one side, pause to spit and then repeat on the opposite side for full nasal clearance. You finish by blowing gently to expel any remaining fluid and then dab your nostrils dry. Avoid forceful blowing that can irritate. Rinse the nozzle and bottle with clean water, allow them to air dry, and store in a clean, dry place to prevent contamination. If you experience stinging or burning, slow the squeeze, use slightly cooler but not cold water, or stop and try a milder concentration next time. This one troubleshooting tip prevents discomfort and keeps the protocol safe and effective.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.